Okay, so we're gonna do a little diagram or visual on how kidney stones will affect the flow and excretion of urine from the body. And we're gonna do, the kidney stones will be in the ureter. Kidney stones can also be in like the kidney, obviously, but we're gonna look at how they affect the ureter. And so the bowl represents the bladder. I made this little tube that represents the ureter, and this represents the urine made in the kidneys and the nephrons or nephrons. Okay, so this is just an example of a healthy ureter with like nothing in it. And then this is the urine, and so it'll just flow nicely into the bladder and then eventually out of the body. So yeah, that's an example of a healthy one with no kidney stones in it. We're going to do an example of a ureter with kidney stones in it, but the kidney stones are small enough where they can just pass with the flow of urine and with just enough fluids. And these kidney stones in like a real body would be up to 4 millimeters. And so those little brown things in there, they represent the kidney stones. And this is what they look like just in there. So it's the same thing, the urine, and again, they'll just sort of flow out of them. Yeah, they're just gonna flow. Still, they just flow out with urine and you can just excrete them. Okay, so now I'm going to do an example of a larger kidney stone and how it affects the ureter and like the flow of urine. And the little brown bottle represents the large kidney stone. So as the urine is trying to go to the bladder, that kidney stone will obstruct the flow of urine and will cause that urine to build up. See, it's like almost done. And when that waste gets built up, there will cause an infection because that waste needs to leave the body. And also that buildup and that obstruction of flow is also very painful for the person as well. That's why it will need medical treatment. And these kidney stones in like a real person's body would be around 5 millimeters or more.
Hi, I'm here to talk about treatments that you can use to treat your kidney stones. Now, treatments vary depending on the size of your kidney stone. So if you have small kidney stones, you could just be sent home because a doctor doesn't need to be monitoring them at all times because they aren't really life-threatening and they can just pass on their own. So the doctor could just prescribe you to drink lots of water every day. They could give you some pain relievers like Advil, Tylenol, or Aleve to manage your pain because it is very painful to pass kidney stones. And they could also give you things like beta blockers, muscle relaxers for your ureter. Also to treat larger kidney stones, like one technique is through lithotripsy, and that's basically just different ways to break up your kidney stones so that they can pass as if they were smaller kidney stones. Another technique used is ureteroscopy, which is when they insert a tube through your urethra to the bladder to find and remove the stone. And if the stone is too large, they use a laser to break it up so they can remove it through the urinary tract. This happens rarely, but if the stones are way larger than expected, then a surgeon can go in and surgically remove kidney stones.